Welcome to the Holistic Health Bites podcast. I'm your host, Andrea Nicholson, crime scene investigator turned functional health investigator. This podcast is here to share bite-sized episodes and unique interviews on a wide variety of health topics to empower, enlighten, and educate you to live your best, most vibrant life. Disclaimer: all information you hear on this podcast is for information only and constitutes individual opinions of the person speaking. This should not be taken as medical advice. Being a listener of this show does not initiate a practitioner-client relationship between you and the hosts or panelists on this show. Please discuss these topics with your medical professionals before making any changes to your health. Okay, let's dive in. Welcome back to the Holistic Health Bites podcast. Today, I am joined with Sandy Sanderson, who is going to share a really interesting story about her own health journey and the things that she's learned along the way. So thank you so much for joining today, Sandy.
Thank you. I'm so excited to be here. I appreciate you having me on.
Yeah, I'm really excited. So will you just kind of quickly introduce yourself and tell everybody a little bit about your story and maybe give a little hint about what we're going to talk about today?
Sure, I'd be happy to. So as you said, my name's Sandy Sanderson. I'm a family nurse practitioner. I'm located in Thompson Station, Tennessee, which is just about 30 minutes south of Nashville. I've been a nurse for 27 years. Gosh, that seems like a huge, big number. And decided in 2018 to go back to school and become a nurse practitioner. Little did I know that that was going to be in the middle of a pandemic,
Right.
which brought us into a whole new realm of healthcare. So I started my private practice in 2021. Sangio Wellness Center, and we're primarily telehealth, but we also offer in person, and I work mostly with individuals. We're dealing with HPA axis dysfunction, long COVID, hormone balancing, medical weight loss, a little bit of everything. I had the great honor of working with a Institute of Functional Medicine certified nurse practitioner during my clinical rotations for nurse practitioner school, which really opened my eyes to a different way of delivering truly integrated care. And I had started on my own functional health journey back in 2016. Previously had a holistic wellness center. Unfortunately, we had to close it in 2018, which COVID would have put us out of business anyway, the whole pandemic. But it kind of launched me into a different trajectory of how to treat health symptoms. And that kind of came from my own story, which you were just kind of speaking about a moment ago. From the time I was about 30, I developed all of a sudden a bunch of health issues that I couldn't explain. And most of my testing was coming back normal, but I had put on 30, 40 pounds. I was sleeping 10 to 12 hours a day. I was exhausted all the time. I was having horrible depression and anxiety, and we just couldn't figure out what it was. A friend recommended that I go on a gluten-free diet, and I thought, I'm a healthcare provider. I teach this for a living. I'm not doing one of these fads.
Right.
But she's like, you should really try it. And I read Wheat Belly. That's really what kind of got me started in this. And it made sense. I got to about the third chapter and I just cried. I said, they could have been writing this book about me. I had all the symptoms. And so I went gluten-free. And that was the start of my journey. And within 30 days, I had lost 10 pounds. And within 6 months, I was down 15 pounds. And at 40 years old, I became a marathon runner. My anxiety was under control. And I never felt better. And I had lost a total of about 40 pounds. And so it was all inflammation. My doctors had always said I had something autoimmune going on, but we never quite knew what it was. And then I had another flare up and became dairy sensitive about 6 years ago. And so then I went dairy free and I still had issues. And so then we started back down and my anxiety came back. So we started back down the pathway and there was some kind of systemic inflammation going on. So I've been kind of on this roller coaster of autoimmune type issues for many, many years now. Well, then along came COVID. And I developed COVID in 2021. 2021 in February. And on the tail of COVID, I developed dysautonomia, a POTS syndrome. I started having flare-ups of random skin rashes. My anxiety was off the charts. I had neurologic inflammation. I had no exercise tolerance. I now was short of breath going up one flight of stairs. I was a marathon runner prior to this. Put on a bunch of weight again, systemic inflammation, and all my joints ached. Just nothing made sense, but all my tests were coming back negative. And of course, the doctors say, everything's fine. There's nothing wrong. Yet I was a metabolic train wreck. And so I started learning about long COVID syndrome. And that's a little bit about what we're going to talk about today was my own journey over the last 2 years of going through this whole cellular metabolic disruption that happened on the heels of having COVID. And it's something that we're starting to see a huge increase in. And as COVID has been around longer and longer, we're learning more and more about, what's happening within the body with somebody who contracts the COVID virus. And it's going to require us to practice medicine differently to really address the root causes of this syndrome that happens to quite a few people after COVID has resolved. And it really can be very disruptive, and it can be life-changing. And that was kind of my story. And so, it really, again, piqued an interest in me of how do I help people like me who have, you're feeling horrible, you can't function on a day-to-day basis, yet everything's normal from a traditional medical perspective, but you can't function. And so that's kind of what we're here to talk about today.
Yeah, you obviously have a tremendous story here, and there's a lot to unpack just in
There
your
is.
story, let alone in, the stories of the patients that you've seen and the people that you've worked with and, other colleagues that I'm sure you've worked with as well. There's so much there. So let's back up a little bit to even before the COVID situation and just talk about just the underlying inflammation and kind of that autoimmune process that you already had going on. For you, that was, the gluten and the dairy sensitivity, or at least that's kind of what, ended up helping you the most. And that probably was a big trigger for you. Is that what you typically see in people who have conditions like that? Is it generally a gluten or a specific food sensitivity that's the trigger, or are there lots of things that could be that trigger for any individual?
Yeah, there actually are lots of different things that could be triggers. What you will typically see with many functional or integrative health providers is when we begin working with individuals that have autoimmune type conditions, we will often start with an elimination diet because foods are a trigger, but they're typically not the root cause of what's happening. There's a whole field in medicine called epigenetics and nutrigenomics. And it's a lot of big fancy words that basically say our lifestyle choices or our lifestyle and the foods that we eat can alter genetic expression. And so if you've got something already brewing underneath, throwing something on top of it that can turn on or turn off different genetic expression can certainly exacerbate it and make the symptoms 10 times worse. So in order to control systemic inflammation, we need to start by removing things from, our lifestyle or our diets, whether they be environmental toxins, our cosmetics, the foods we eat, the candles we burn that might have, synthetic fragrances in them or air fresheners, all of those things. We start to remove those so that we can calm down the fire, so then we can get to the root cause of what's causing the inflammation. And, an analogy I like to use with a lot of my patients is if your house is on fire, that's not the time to investigate the root, what started the fire. You have to put the fire out first before you can figure out what caused the fire.
Yeah.
And so that's really what a lot of the dietary modifications are, is starting to put the fire out. So then we can start to dig in and find out what caused the symptoms to begin with. And that's really an individualized approach of using, very specific targeted testing. Much of that is functional, what we consider functional testing. It's either urine, blood, stool, saliva testing, depending on what it is we're looking for, to really dig in and find out what's causing the inflammation to begin with. Then we know how to be very targeted in how to treat it. But almost all autoimmune or mitochondrial or metabolic disorders, the treatment starts with lifestyle and diet modifications.
For sure. And do you find that when people do make those changes that they feel better pretty quickly? Or are there some times where it's like, oh, I took gluten out and I don't feel any different at all? And
yeah, it
that
can
doesn't
be.
necessarily mean that's not the problem or contributing to the problem.
Exactly. You know, most people, if we put them on a true elimination diet, and there are many different elimination diets, you can start with just gluten, you can start with gluten and dairy. I like to prescribe to a little bit more broad autoimmune, anti-inflammatory diet and remove, the top 5 to 7 most inflammatory foods. Most people start to feel better within 1 to 2 weeks. And I say 1 to 2 weeks because the first couple of days you might actually feel worse. If you're somebody who eats a lot of sugar and a lot of gluten, those interact on the centers of your brain, that drive pleasure, and they can have a physiologic addictive component to them. So as you start to remove them from your body, you crave them. So you go through a little bit of a withdrawal. And then as your body starts to detoxify and eliminate the toxins and the byproducts from your body, you go through a little bit of a detoxification process, which can give you some body aches and a little bit of a flu-like feeling. So you have to get past that first 5 to 7 days. Okay. Once you get past that, you really start to feel better. And most people say they feel better, their energy is better, they're thinking more clearly. Some people, their breath doesn't smell as bad, or, their stool doesn't smell as bad because it's not loaded with toxins. And so most people feel a lot better within that first, 2 to 3 weeks.
Okay. Well, that's good to know that some people that really can happen that quickly. So then when you dive in deeper and you're doing some of that testing and, really trying to figure out the root cause, once you've got the fire out and now you're trying to figure out, the bigger cause, what are some of the things that you end up finding through that really are at the root of somebody's issue?
Yeah. So the most common things, obviously there's a million things out there that it could be. And so that can really lead us down a different pathway. But as a general rule, the things that we find the most are hormonal imbalances, which are really prevalent. And we're even seeing that now more in younger women into their 20s and 30s. Our food supply chain's not what it used to be. They're adding all sorts of chemicals, hormones, antibiotics, things to our food chain or to our foods that weren't there many, many years ago that are endocrine disruptors. So we're seeing, hormonal imbalances. We see a lot of issues with adrenal glands, not so much the adrenal glands themselves, but the connection, that hypothalamus, pituitary, adrenal, what we call that HPA axis, and how they all communicate to one another. And that can lead to a lot of systemic inflammation. We see thyroid dysfunctions, and quite frequently when we do a complete thyroid panel, not just a TSH or a free T4, but we look at the entire thyroid panel and antibodies, we find underlying Hashimoto's thyroiditis, which is very common and probably more prevalent than people realize because we don't test enough people for it in traditional medical practices. As a general rule. I see a lot of gut dysbiosis or GI, imbalances that can lead to leaky gut, that can lead to serotonin depletion, that can impact the immune system. So there are a lot of different things that we can find in there that we kind of have to unpack based on individual symptoms and what's happening. And sometimes it's a combination of all of those things. Yeah. And it makes it that much more complicated because you're trying to piece together a puzzle of a lot of different things. But the beautiful thing is the underlying treatments are often, they have a lot of similarities, so we can treat many of them with a general protocol, and then we individualize it from there.
Okay. Yeah, that makes a lot of sense. And yeah, I see that a lot in my practice as well, that whether you have insulin resistance or gut issues or food sensitivities or whatever, a lot of times, yeah, the same remedies end up addressing all of the things. So yeah, cleaning up the diet, fixing the lifestyle, focusing on sleep and stress and removing toxins. And I mean, all the same things that you use to put the fire out can also really make a big difference in moving the needle on those other things. So I love that. You mentioned the top 7, 5 to 7, whatever, the most common food sensitivities. What would be beyond dairy and gluten? What are some of the other ones that you often will take out or find that most people are sensitive to or get inflammation from?
Yeah, so that's a great question. Gluten and dairy, sugar.
Mm.
Sugar is the devil. And I say that with a smile on my face because I'm a sugarholic. and I love my sweets, but sugar is very detrimental and very pro-inflammatory. Um, Peanuts for a lot of people, because peanuts, are unlike tree nuts, peanuts are grown underground, so they tend to harbor mold. And people who have mold sensitivities, peanuts can be a huge trigger for them. Soy in some individuals is inflammatory. Now, soy can also be very healthy, but bioengineered or genetically modified soy is very different than, organic, non-genetically modified soy. So we will typically remove that for a while. Some people, corn is a big trigger for them. Eggs can be very inflammatory for some individuals. So when we really kind of start out, we like to go about 30 days removing all of those things. And that can seem really overwhelming because it's like, well, what's left to eat? Yeah. And really there's a lot, yeah. There's tree nuts, there's fruits, there's berries, there's vegetables, there's meat, as long as it's not marinated in a bunch of, sauces and things like that. So it still does leave a lot, but it really cuts out a lot of processed foods, and really gets us back to a more heavily plant-based and meat or fish, for your protein type diet for 30 days. And that really makes a huge difference for a lot of people. Now, at that point, we can either do food sensitivity testing to see, and we like to do that before you start to remove things because you need it in your system for it to show up, on food sensitivity testing. So we would typically do that first and then do some removal. Or if people don't want to do that testing, they can just remove all of those things and then slowly wait 30 days and then introduce the one food at a time back in and see how your body responds to it. If you don't have any reactions to it after a few days, then that you may be okay with that. And then you wait a week or two and then you add the next one back in. So there's a couple of ways
people have sensitivities, like say to gluten. I know a lot of my clients will say, I don't feel any different whether I'm off gluten or on gluten. Like I don't feel any different. And yet when you look at like their stool test or food sensitivity testing and they're off the charts having these huge reactions, mm-hmm. Do you find that sometimes can be tricky for people that maybe don't feel any different with or without certain foods?
It can be, but one way to describe that to them as a provider is, I would say, there's a lot of people who have silent hypertension. They feel fine with blood pressures through the roof that put them at high risk for a heart attack or a stroke, but they function just fine because their bodies become accustomed to this kind of dysfunctional level of functioning. Or people who have diabetes and they don't know it until they go into the hospital in some kind of a medical emergency and they find out their blood sugars are through the roof, but they felt fine, so yes, it can be. Most people, once you start to remove it and you give it time to detoxify from their body and get back to some semblance of normal, they will start to feel better. Yeah. They may not realize it until they go back and eat gluten again. And then they have a flare up and they're like, oh, I didn't know how bad or how good I felt until I felt bad again, Yeah. So sometimes, it's as simple as that, but some people just don't experience symptoms or perceive their symptoms in the same way. And they've gotten so used to feeling that way that they feel fine. But medically, it's still not a safe situation for them.
Right. Yeah, it's still causing underlying inflammation, whether you can physically feel it or not. And it's not
Right.
always such a linear thing where it's like I eat this and I instantly feel this. It doesn't always
Well, and that's
happen
about
A,
food
that quickly or
sensitivity.
B, that linearly.
Yeah, well, and that's the thing about food sensitivities is if it's a true allergy, you usually have a reaction right away. But with a sensitivity, you may not have symptoms until up to 1 to 2 weeks after you eat the offending food. So it's
Yeah,
very, very hard to pinpoint exactly what it is that you're sensitive to and what's causing your symptoms.
right.
Even food journals make it hard unless, I eat this food and within 3 days I get a migraine. It's a pretty straight trigger, but
Yeah.
for a lot of people, it's hard to figure out exactly what it is, which is why
Yeah.
the testing is so helpful.
Yeah. Yeah. I love that. Okay. So let's transition a little bit more into the COVID side of things and that kind of chronic inflammatory syndrome that's occurring in a lot of these people. So tell me a little bit more about, how it's developing. Are there any commonalities in people that you've seen who end up with like long COVID or these, longer term symptoms? Any correlation that you've seen?
Um, yes and no. I think we're still learning a lot about it. Although the last 2 years have taught us a lot, and provide or different researchers have really started to dig in to try to understand it. And there's much better literature and research out there now. But it's definitely a growing prevalence. And as we talk about it more and people are able to connect the dots, I think we're seeing that more and more people are actually suffering from this long COVID syndrome. And I call it a syndrome because long COVID in and of itself is not a condition. It's a grouping of conditions or syndromes that have a cascading effect throughout the body. And so we're learning a lot. But one thing we do find are individuals who have the risk factors that already put them at risk for COVID complications. So, obesity, underlying heart disease, diabetes, asthma, COPD, other autoimmune type issues. They already have a high risk. And so their risk of developing a longer term syndrome is much higher. Some of the literature that's coming out now is showing that it's more prevalent in women over the age of 50 because there's some connection with estrogen protection in how your body is able to recover from this inflammatory process. And as you get older and you have declining estrogen levels, you are more prone to having some of these complications.
Okay.
Individuals with autoimmune issues already, we're seeing either the emergence of new autoimmune, because once you have one autoimmune condition, you're high risk for others.
Yeah.
We're either seeing the development of new autoimmune issues or exacerbations of what they already have, or new presentations of things that maybe they had under control and now it's creeping back and it looks different, or it's behaving differently.
Okay.
So those are really kind of what we're seeing as the highest risk kind of patterns of individuals. But it can really impact anybody.
Okay.
Individuals who never had a problem before all of a sudden are developing POTS or mast cell activation syndrome, where they're having this histamine overload and this immune response within their body. Individuals, COVID also, it's very pro-inflammatory and it's pro-thrombotic. So we're seeing, more vascular inflammation, which can cause problems in the heart, brain, kidneys, and lungs. It can lay down microvascular scarring or even more large scale systemic scarring, which impacts oxygen transport and energy. The spike protein on the COVID virus itself, the way viruses get into cells is they attach to the cell and then they go into the cell and they modify the cell activity. So it's impacting the mitochondria or the energy center of the cell. So we're seeing, issues there. We're seeing people developing cardiovascular issues, blood clots. You see it on the news all the time. There's more and more people with sudden cardiac death at younger ages or heart attacks and such. And so it really is a game changer, and it really is making us have to figure out how to slow the progression or stop it altogether.
Okay. And so is this more commonly seen in people who maybe had not necessarily severe COVID where they were like hospitalized and, on ventilators and stuff. Maybe not to that extreme, but people who were sicker with COVID, because some people barely got any symptoms at all. And like it was kind of a cold. Some people didn't even know they had it. And some
Mhm.
people obviously were sick for a few weeks and really had a lot of coughing and fevers and, just all the things. So is this more common in people who had a little bit more serious illness when they actively had COVID? Or can someone who had a minor infection or, seemingly minor symptoms also see some of these long COVID symptoms?
Actually, you can. So yes, obviously, if you had a severe infection, much higher risk.
Yeah.
And if you had, many people who had the severe infections, not all, but many had some kind of underlying health condition, which already increased their risk factors. But actually, the research that's out there, and there's a couple of physicians that have done a lot of research in this area, they're finding that even individuals who had very mild symptoms can end up with long COVID syndromes. And individuals who have some type of a long COVID syndrome or have had COVID more than once, they have a higher prevalence risk of developing a long hauler type syndrome or a post-viral syndrome. So it really is not necessary. It doesn't require that you had a severe COVID infection to develop long-term effects from the virus.
Okay. And have we seen stuff like this with prior viruses, or is this like a completely novel thing to this virus?
So post-viral syndrome's been around a long time. Individuals who have had the flu or other viruses often feel for several weeks after they recover that, that just my body is just tired. I don't have the energy that I used to, might have a little bit of brain fog. So, I mean, post-viral syndrome is not new.
Okay.
But this particular version of post-viral syndrome is more novel
Okay.
because of the scar tissue that it can lay down and its affinity for the lining of blood vessels in the way that it attaches to the capillaries and increases the risk for micro blood clots and creating that scar tissue and that vessel inflammation, that permeates all of our organs of our body. This is a syndrome that really can cause systemic damage to multiple body systems. And we don't know exactly who's going to get it and who's not.
Right.
So,
Okay. And so let's transition a little bit to if you think you have long COVID, first of all, how do you know for sure? And second of all, what do we do about it?
great questions. So, how do we know for sure? I don't know that we ever 100% know for sure. What I will say is this is kind of where traditional medicine and integrative or functional medicine intersect. Some of the symptoms that go along with um, long COVID syndrome or long hauler syndrome or post COVID syndrome, whatever we're calling it these days, um, shortness of breath. Some people can have dizziness. You can have changes in your blood pressure and heart rate, a rapid resting heart rate. We have to, because we know that COVID can cause scarring, it can cause blood clots and other things. We have to exercise some modicum of caution, which means we have to rule out the big stuff. We have to be safe and we have to follow standards of care. And so, and this is, I'm saying this because I see a lot of Facebook forums of people out there that like to share information, and I'll see people, oh, well, just take this supplement or take that supplement. Well, that might be okay, but first you have to make sure that you really are ruling out the big stuff, because we do know that COVID has a higher prevalence association with heart attacks, strokes, pulmonary embolus. So we need to rule those things out if you're having those symptoms. We need to be responsible providers.
Yeah.
Once we've ruled out the big stuff, then, and we know that everything's safe there, then we can start to dig in. Again, put out the fire first, and rule out the big stuff that could be life-threatening. Then we can start to dig into, is this long haulers? Long haulers, again, is really more of what is the timing of the onset of symptoms and the prevalence of symptoms in relation to having a viral infection. And so the long haulers itself, again, like I said, is not a sorry, leg cramp. It's not a condition in and of itself, but it's more of something else is going on as a result of having this infection. So we have to start to dig in and figure out what the root cause is. And so there is not a cookie cutter approach to treating long haulers. It's really very individualized based on what we're finding are the root cause of the symptoms the individuals are having.
Okay.
It can require some pretty extensive testing sometimes, and most of those tests are not covered by insurance, so that does make it challenging. But so many of the symptoms overlap between different conditions. You may have more than one thing going on that we need to kind of balance to bring somebody back to that state of health. But we have to kind of figure out that puzzle and what's happening with that person and then tailor the treatment. The treatment usually consists of, as a general rule, calming down the inflammation. We have to get the inflammation under control. We can do that through lifestyle modification as well as through supplements or medication. In some instances, medication is necessary. We have to restore the body. And what that means is your body has different metabolic needs at this point because your cells have been impacted, those mitochondria, those energy centers. So excessive exercise is probably not going to be great for a lot of people, but you have to do something or else you end up being very deconditioned very quickly. So getting onto some type of an activity routine that is sustainable for whatever state you're in medically at that point. Sleep, restorative sleep is incredibly important. And you probably will require more sleep than what's normal, but you want that sleep to be on a regular schedule and not at just random times of the day, because then you can't sleep at night and you're not getting on that proper circadian rhythm. We want to look at stress modification. So doing some type of yoga or meditation or something that allows you to calm the stress, because that stress just puts extra pressure on your autonomic nervous system, that can worsen inflammation. So we have to get stress under control. And then, from there, as we spoke earlier, we need to detoxify our environment as much as possible. We won't ever get 100% away from toxins, but what choices can we make that make it a little bit easier on us? Then we start to delve into supplementation, diet modifications that might be most appropriate for that individual, and seeing if medication is necessary to reverse certain conditions.
Okay. And then how long does this process usually take? I know it's going to be bio-individual and it's going to, vary by all the different underlying causes and stuff, but is there kind of like you should probably plan on 6 months, or you should plan on, is there at least some kind of estimate?
Yeah, I would say as a general rule, probably 6 to 12 months.
Okay.
Because again, it depends on the number of body systems that are affected and what we're dealing with. If we're only dealing with one imbalance or something that's pretty amenable to treatment, we might be able to get reversal or improvement in as little as 3 months. But for most people, it's multifactorial. It's multi-system. And we want to bring things back into balance, but you also have to do that at an appropriate pace that you don't put your body into shock. So we need to do it in a very graduated, methodical way. And so that usually takes at least a good 6 months. Now, people might start feeling better within a month or two as we're starting to get some of the symptoms under control, but to truly treat the root cause of it, we're probably looking at a good 6 to 12 months.
Okay. Yeah, I think it's always nice for people to know kind of what they're getting into instead of coming in with the wrong, like, I'm going to feel better in 2 weeks kind of attitude. And then they're frustrated when that didn't happen. So I think it's always good to just be honest with people. And, this is going to take time. It takes time to repair damage, to clean things out, to eliminate things. And there's a lot of changes that have to be made all along the way, regardless of what you're trying to solve. Even if it's insulin resistance or a gut infection, like, it takes time. These things don't just happen overnight. So I think it's always good for people to have that, in their minds. So,
well, yeah. And if you try to treat it too quickly, they'll actually feel worse than they'll feel better. And they'll go, oh, well, this isn't working for me. I felt, 5 times worse once they put me on this treatment. Well, you probably did, because we're we're eliminating toxins from your body. We're changing the way your cells are working, and you can get all sorts of brain fog and confusion. And I had neurologic inflammation too, so anxiety and depression and nerve pain in my hands and feet were terrible. So it really does. It has to be a gradual process, or else we can make it worse before we make it better.
Yeah, and we definitely don't want to make it worse when you're already miserable and already, frustrated with how long it's taking. You definitely don't want to make it worse. That's not going to help.
Yeah.
So if people are interested in learning more about your work, or if they think they have one of these conditions and they really want to get to the root cause and start working on fixing it, how's the best way for them to reach you?
So best way to reach me, well, there's a few different ways. I do have a Facebook community. It's Sangio Wellness Sandy Sanderson. You can join the Facebook community. I have a website. It's Sangio, Sangeo, wellness.com. Sangio is me and my husband. I'm Sandy. He's Jeff. We're a family business.
Love it.
But sangiowellness.com, there's information out there on how to contact me. And you can also, if you're looking to see if you want to work with us, now we are in Tennessee. We do telehealth all across the state, but for those living outside of the state, we are actually working on developing a course to kind of help walk people through this. My goal is to have that out by the end of January. So on the website, there's an opportunity to opt into our email list where we can send information out. If you want to have a discovery call with us, you can book that right online, or you can call us. Our phone number's on there. It's also 931-797-8646, but it's also on the website. And you can reach out. We can do a free discovery call and see if this might be a fit for you. If you need to work with a provider and you're outside of the state, you can either come and visit me in Tennessee, which some people do travel in. Yep. And I'd be happy to see you if you wanted to come to Tennessee to see me. Otherwise, I can connect you with somebody in your state that I might know that can help with that particular type of treatment. But lots of ways to reach us. For anybody that's watching this podcast, if you decide to work with us, we're offering a $250 discount on your program, which, is helpful because obviously these are not cheap programs. Yeah. And insurance doesn't pay for them, but we try to work with people the best that we can to make it as approachable as possible. But all this functional testing is not cheap, so I like to be very honest about that up front so people know what to expect. But we will offer $250 off if you mention this podcast when you book with us. And like I said, we're always happy to do a free discovery call and see if we can help you.
Yeah, I love that. And we will definitely link up all that information in the show notes. So it'll be really easy for people to just click on or copy and paste or whatever they need to do. So we will for sure do that. Thank you so much for sharing your story and just all the lessons that you've learned and the new science on this emerging problem that's just growing by the day. And hopefully we can get a good handle on it and it won't continue growing by the day. So hopefully people can start reversing it and feel better. So thank you so much for sharing all of that.
Well, thank you so much for having me on. It's been a pleasure. And I hope that we can, like you said, can get a handle on this and we can start getting people to feel better. And even if we can't slow the progression of it, at least people are aware of what it is now and know how to approach getting some improvement in their quality of life.
Yeah. And I'm hopeful that people will take the bigger lessons here of how to get in better metabolic health before you get a virus like this. And hopefully that will minimize the post-viral infection problems, because I'm sure this won't be our last. We'll have some other infection in the future that's going to cause this stuff too. So, fix your metabolic health now, and hopefully you won't have to deal with this in the future, or at least we'll know a whole lot more to deal with it quicker and better.
Well, there's definitely something to the old adage of an ounce of prevention is worth a pound of cure.
Yeah, for sure. Yeah, it's way easier to prevent something than it is to try to reverse it. Although it can be done, it's just much easier to prevent it from happening to begin with. I love that.
Absolutely.
Thank you so much for everyone out there who is listening to this, and we will catch you again on future episodes. Did you know I also work one-on-one with clients? I approach solving health challenges like I approached solving crimes, by conducting a thorough investigation into your case. Sadly, hundreds of millions of people in the US have insulin resistance, prediabetes, and diabetes, and the vast majority have no idea. I'm here to fix that. If you struggle with low energy, stubborn weight, hypertension, sleep disturbances, or any other undesired symptoms, let's talk. All you have to do is schedule a free call. The link will be in the show notes. And no, you do not need to live near me.